the Imperial County Medical Society. I am not a physician, okay? But I have been up to my ears in COVID since the onset. I was on the county vaccine committee when the governor's rules were so crazy. We had 270 categories of people eligible, and they were only giving us 1,200 doses for the entire county. I was there. With our president, we wrote letters. I actually backdoored into a friend of mine who's at the state level, got the personal email address to the head of the Department of Healthcare Services, and basically told him, look, I know you're allocating by population and not by the Healthy Persons Index, and we're going to go to the newspaper with this if we don't start getting some help. Lo and behold, next week we started getting 89, 70 per week, and we've just gone on and on. In fact, one of the funny stories of this is I never knew the governor had a regional office for Imperial County and San Diego and Orange County. But when I got that letter, I had calls from them like every other day. You happy? No, I wasn't happy, but you got to do with what you got, okay? So that's that history. Let me give you another history. I taught this community for over 30 years. I may well have taught some of you or your children. I was known as Mr. H. Wilson for 15 years. I was Mr. H. Kennedy for 15 years. I taught middle school social studies. A little additional background is I grew up in South Carolina, about as prejudiced as any human being can be, where I came from. In fact, the Southern Poverty Law Center, within the past 3 or 4 years, seized the building that was owned by the Klan in my town. I had the good fortune to move to a place in New Hampshire, and I met a social studies teacher, actually made a lifelong impact on me. And he didn't get in my face, but we started talking about race. And he actually recommended a book to me. And if any of you are readers and you haven't read this book, it's called A Shade of Difference. It was written by the same guy that wrote Advising Consent. Probably the most impactful book in my life, and I've read a lot of books. And it's on my shelf. And basically it was based in the United Nations, and the whole concept of race was discussed in a way that made a difference to me. So how did I come to you? Oh, one last thing. I have been an author. I was published school stuff. These things were put out by J. Weston Walsh. It's called The Second Reconstruction. I wrote it in the early 80s. It was about the civil rights, the modern civil rights movement. So I've been involved. I was looking at stats, and I freaked. And here's the stat. It's on your, why do we need to talk as African American community? Your community is most heavily impacted by COVID, generally in the nation. Sir?
Who's the author of that book here?
I'm sorry?
The author of the book?
I'll look it up. But he wrote Advising Consent. He's world famous. Yeah, he's a very famous author. It eludes me this moment. Blacks have the highest percentage of COVID cases nationwide and the most severe clinical presentation. When they show up, they got big problems, severe problems. And the highest rate of hospitalization, morbidity, and mortality in adults and children. People haven't figured out why are kids getting involved. Simple. The most critical adults have already been basically infected one way or the other, or they've been vaccinated. Now it's being spread in a whole bunch of ways. So kids is a new and emerging market. I can't even give you realistic data on it yet. For any of you that are interested, I listed some websites on here. Kaiser Family Foundation is a great website if you're interested in this and you really want to do stuff. Or you just reach out to me and I'll give you the links and it'll save you a whole bunch of searching, okay? Everybody should have my card. If you don't, you can have one. But this is the number that grabbed me. If you look at our county by race and ethnicity, deaths by race, blacks represented at the time of this data 13% of the deaths. Yet the black community represented 4% of those vaccinated. So triple the rate of vaccination. I called Marlene. I said, Marlene, just from the perspective of who I am, I taught civil rights my whole teaching career. This is really, really bad. And because this community is so focused on the Hispanic community, because they are the majority, we need to focus on our local black community. Really, really important. So I'm changing slides now for those of you who want to look along. So why are, in the past, have the black community been hesitant? Well, you all know about Tuskegee. And I'm not going to read to you. I hate being read to. I really hate it, and that's why I printed these things out. You can take and look at it in depth. But the black community was fearful. Rightfully so. There is no question that the community in the past was dealt with inequitably, and not just inequitably, I mean outright deception. Not going there. But I will tell you, the tests for the COVID vaccine are literally millions of people across all ethnicities in the whole world. Okay? And so we have to acknowledge the reason for hesitancy and then move past it. The new surge is the people we thought were going to get away clean. Remember the first two waves, 20s to 40s? None of them were getting sick. You all know viruses evolved. The Delta variant is 9 times or better. I hate to quote a number, but my most recent recollection is 9 times. There's a thing called R sub T. That's infection rate. And a person with the flu is an R sub T of 2. The R sub T of COVID Delta variant is 9. That means one person can be reasonably expected to infect 9 people. Okay? So this is not something to be laughed at, and not something this is where we need to move forward. That's why I came to Marley. Some people say it's not your business to stick your nose into the black community. That's wrong. If I know something and I'm willing to share it, and you can take these back and use these to help your parishioners and the people you deal with, that's what it's for. I didn't do it just to talk to this group. I'm hoping to have this have some impact within the community. So, the adults. What are the adults' questions? It says adult answers to adult questions. And basically, is the vaccine safe? Is COVID still a threat? How do we know the vaccines are safe? And is it safe to me if I would like to have a baby one day? So let's go down the line. Without reading all the data, these things have been through extensive, this is the most tested vaccine in history. Well, people say, well, it's too fast. How did that happen? They started working on RNA, which is a medical thing that I don't get involved in. You know, I had my full of biology in high school, and that was it. But here's the deal. I do know this from doing the reading. SARS is in 2000. In fact, we have a pediatrician in this valley that lived in Malaysia. This is his second pandemic. He went through SARS. His name is Ray Lu. And he was the first physician in this valley, as far as I could tell, that absolutely went bug nuts when this thing came out. He was on me like, we got to do something about this now. And he turned out to be quite right. So he's had the experience. But these were tested in tens of thousands of people. The long-term side effects are extremely rare. And even if you were to have a side effect, even a rare side effect, for most people they prefer that to die. It's as simple as that. This is about keeping people above ground. Bottom line. Okay? And I'm going to throw in here just as a side, we're starting to see the emergence of some side effects in children that we didn't see in the original Alpha variant. The Delta variant, we're seeing results in children. So we'll get to that, what about my kids kind of thing here in a minute, but we need to pay attention, okay? There have been, so far, no recorded long-term effects of significant, this is like in 0.00017%. It's minuscule. In fact, one doctor I've read said that you're more likely to get hit by lightning than you are to have a side effect. Now, if you're the one hit by lightning, that's not pleasant. But the likelihood of that happening versus the consequences of not being vaccinated are so that you've got to encourage it. Is it a threat? COVID-19 is a threat. It's evolving. Obviously, I live and breathe this stuff. The first thing I check every morning when I get up, can you imagine this for a year and a half? The first thing I check in the morning is Imperial County Medical Public Health Department. And I want to check 3 numbers there. Number of people in ICU, that's bad. Number of beds available, how are we going to be able to treat them? And the worst, number of ventilators available. 2 weeks ago, we had something like 68 ventilators. We're now up to 76. But 2 weeks ago, we had 0 in use. We are experiencing another wave. And I would not be surprised at all once school begins and kids become cross-transmitting and going home to mom, grandma's watching, granddad's watching, they're taking care of the kids, auntie, uncle. Vaccination is so important. Get vaccinated. And these are all facts, okay? How do we know they're safe? Well, we know first of all, the numbers I just gave you. The most important other number is there are breakthrough cases. Everybody knows what that is, right? Nobody doesn't know what a breakthrough is. That's a person that's been vaccinated and catches COVID. I personally, right now, know one doctor and one individual that have a breakthrough case. What does the vaccine do for them? It keeps you out of the hospital and it keeps you from dying. You might get sick. Anybody here ever had the flu? Pretty miserable experience. I'll take the flu over dying or a tube in my throat any day of the week. And by the way, I need to mention that. My voice is really, I've always been loud. I'm very deaf. If I'm too loud, just go like this and I'll lower my voice. I'll try. Probably won't last long. My wife gets on me for all the time. If I'm too loud, you just tell me, Tom, why are you shouting? I'm not shouting, I'm talking. Okay. This is a critical question. Is it safe for me to have a baby if I'm with the COVID vaccine? Listen clearly. Take this to your friends. Last week, the vaccine was recommended by both major American gynecological associations. Yesterday or the day before, on the 12th, the CDC said, not only is it okay, we recommend every pregnant person take this vaccine. You know, mandates like that are few and far between. Okay? So it's obviously an important thing to get this vaccine. Answers for your children, your adolescents. Remember, we do not have a vaccine for those under 12. What age do they start school? 4? 5. We have a big gap there. There are trials, clinical trials going on now. Obviously, just like everything else, they're not going to prove anything, even for emergency use, without clinical trials. We do expect to see the major vaccines, Pfizer within the month, Moderna within 2 months, receiving full authorization. A lot of people say it's not authorized. Well, it's working. Sometimes you will put something on your car to make the thing work, and then you come back and you fix it up a little better later on. No? Okay. So, the kids, how does it work in adolescence? Is it safe for the child? Why do children need it since they don't get sick if infected, which is now not true at all, and will it impact the child's development? It is as effective on 12-year-olds and up as it is on adults. We already know that pretty much guarantees you a 95% chance that child is not, even if they get the COVID in school or from their friends, they're not going to end up in a hospital with a tube in their throat. You don't believe me? We had a doctor at a pediatric hospital, either in Alabama, Louisiana, or Florida, last night say the only way your child gets a bed for COVID is if another child dies. This is not a joke. This is honest to goodness for real. Okay? All right. Remember that vaccines prevent diseases. We've all had stuff, we've all had penicillin and other stuff after we've gotten something. But the function of a vaccine is to prevent the disease. And so parents need that reassurance, and I'm counting on you as community leaders to share this amongst your leaders and your particular organizations. I mean, clinicals, they're on top of it. They've been on top of it. Dr. Vega and I were very close friends. She just moved out. I haven't quite met Dr. Sloan yet, but I need to reach out. Is it safe? Yeah. I've given you the detail. If you want facts and figures, I'm not going to bore you with it. I think that's counterproductive and nobody wants to be read. I just want you to please take this stuff. I will send anybody that wants links. Actually, I think I've got the links on this. If you gave me emails, I will email you this presentation. It's got active links on it, so just click it. You can also show it amongst your different groups, whatever. Okay? No vaccine in history has been as closely watched. It's incapable. Today, we live in a society. I mean, I grew up in a small town where if you did anything, your dad and your grandmother knew it before you got home. Okay? Well, guess what? It's exactly the same now. It's just done electronically. You know? Anything that happens gets out. So, it's been closely monitored. We would know if there